You're the on-call fellow in the MICU and are consulted by the hospitalist on the general medicine floor about a 65-year-old female admitted 4 days ago for treatment of community-acquired pneumonia. Over the last 12 hours, oxygen requirements have gone from 1-liter nasal cannula to 100% non-rebreather. The hospitalist says he thinks the patient may be developing ARDS. You know there have been some changes lately in how ARDS is diagnosed, but it's midnight, and this is your 5th admission, and you can't remember all the changes, so you ask ClinicalAccess. You immediately find the question that you're looking for. This answer gives you the latest diagnostic criteria, complete with all the changes. Not only that, but you also get a great table and examples of chest x-ray findings. You arrive at the bedside to find the patient dyspneic on non-rebreather. The patient is drowsy, and the ABG reveals a severe respiratory acidosis. The patient is otherwise hemodynamically stable. You intubate the patient and prepare for transfer to the ICU. After the patient is intubated, you obtain another x-ray. You ask ClinicalAccess what the x-ray should look like if the patient has ARDS. The patient's x-ray looks to be consistent with ARDS, and the patient meets the criteria that you read about on ClinicalAccess. You must be certain that this is ARDS and not cardiogenic pulmonary edema. How do you know? You ask ClinicalAccess, of course, and confirm what you see in the labs and imaging. There is a seemingly endless list of treatments for ARDS. Do you prone, diurese, or give steroids? What about oscillation? Is that in or out nowadays? You've already gotten 3 more admissions, the lady in 5A is crashing, and now you've got to decide what to do here. You can't look through all those papers. You ask ClinicalAccess. After ensuring hemodynamic stability, volume status, and appropriateness of antibiotic coverage, you decide to administer furosemide. What are the indications for dose reduction? How often can you give that? What are contraindications? You're already on ClinicalAccess. Let's see what it says. You click through to the drug monograph, and you find answers to all of your questions about furosemide. You gave the furosemide, did all the right treatments, and the patient is extubated 3 days later. The patient goes on to be discharged home with her family. You rock.